Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. Hi, I'm Rod Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Let's talk about buccal fat disasters. You know, I've talked about buccal fat removal before, how to do it, when to do it, and please see a recent podcast that I did on this because it really goes through the step-by-step of when it's indicated and when it's not. But so often I see patients that have had buccal fat removed and it looks terrible. And I just saw one 2 days ago that had buccal fat removed and he showed me his pre-ops, and now 6 months later he looks like 10 years older. So don't do it. If you have a patient that looks like this before, don't do it. Even if they say, I want it, you know, she's had fillers and everything else, but this is the result of excess buccal fat removal, because guess what it does? In somebody like this, as beautiful like Bella Hadid, you know, she's also had a rhinoplasty, which of course is another issue, and then she's had buccal fat removed. That ages that person dramatically, because a sign of youthfulness and beauty is a full face, and so you doing that, it just distorts the face. It really, really makes somebody look 10, 15 years older. No, if you want to look older, you should do that. But most people don't want to look older. It's this time and time again that you see. And it's that buccal fat removal that really, really is awful because, and especially in males, it looks terrible. So when you have too much fat removed, and buccal fat, if you don't have fullness right here, in this area right here, a lot of fullness, that means it's convex, not concave like it is on the left side here, then you're a reasonable candidate for doing that. Because the buccal fat has 4 different compartments, and it's the only fat compartment that actually glides from the superficial to the deep fat compartments. That's why if you remove it, it's very hard to replace it because it's a deep and superficial fat compartment that has to be replaced. So it's not easy to replace. So we've talked about the appropriate role of buccal fat removal in aesthetic surgery, and that's a subject of another podcast and YouTube channel that I talked about. And this is a classic example of a patient that actually benefits from buccal fat. He's got a lot of fullness in his lower half of his face. He's young. And he's really got and when he presses his tongue to the top of his mouth, it just bulges out. And I think that's the area that you want to address. And so when you do that, that's very key. You do it in the operating room is what our preference is, and then you just take out the fat in that area, and that's what you really want to do. And it's really something that's very methodically designed, and I've discussed this and talked about it in our major journal, and I've published it. And basically what it does is you're really taking out a small amount of fat inside the mouth through a small little incision. You're taking the fat out, you're shaping it, and you're removing it gently, so you're doing it safely and really in a bloodless manner. And I think that's really important to do. And then when you've done that, then you can assess it intraoperatively of what actually you've done. So here's a patient that just had it done. You can see the buccal fat removed, just very, very gentle. This is the amount of fat that you usually take out. So it's very, very popular, but should only be done in patients that it's indicated in. So I do it in patients, like I mentioned, that have those specific indications. And I probably do 1 in 10 patients that wants me to do buccal fat removal. So remember that. So here's a patient that had buccal fat fullness, and here he is at over 6 months post-op. You can see it's subtle, but you can see it's actually subtly dramatic, and he loves it because he's got nice, he still has contour, but he doesn't look older. Okay, if you do it in a patient that actually looks older, you've missed the diagnosis. You've actually done it in the wrong patient. So know before you go. So I would say the most important thing is they need to have lower cheek fullness, a full face, and less is more. You know, there's 4 buccal fat compartments, and you're just going to take out the one that's in the buccal area inside the mouth. So you want to have a nice result and not one that actually is concave, because that gives you that awful over-operated, but also a very aged look. And so this is not a trend you want to be part of, because it really makes people look older and different. And it is not an aesthetic look. And actually, it's something that's very, very hard to fix, because you'll have to sometimes do multiple different procedures, sometimes doing it intraorally and extraorally. So know before you go. Don't do it. If you have any hesitation, don't do it. Because if you don't want to look older, especially if you're doing it in a patient that has already concavity of her lower face, it's a real hazard to do. So know before you go. Find a board-certified plastic surgeon that actually understands the science of aging and how to do this in a safe, measured manner. So please leave me your comments and your thoughts. And if you like this, go look at my buccal fat removal indications YouTube that actually talks exactly about how to do it, when to do it, and what patients are the best examples to do it. So thank you so much. And again, stay safe, stay informed, and until next time.